Good afternoon, everybody. I'm Andy, and welcome to today's Team Kentucky Update. It is the start of a new year, which means more opportunity for economic growth and momentum in every corner of the Commonwealth. I'm proud to look back on 2023 as yet another successful year of building towards Kentucky's bright future. Since the beginning of my administration, we've now secured private sector new location and expansion projects from companies that have invested over $28.7 billion and created over 51,200 quality full-time jobs. The economic momentum and prosperity we are seeing is not possible without the hardworking folks at the local and state levels who are committed to building a brighter future for all of our families. I could not be more excited for 2024 and the incredible investments and job opportunities that it will bring to the Commonwealth. The last 4 years have been record-breaking, but there is so much more to do. With that, I have some great economic news to share for our first Team Kentucky update of 2024. Leaders at Crown Verity USA will expand their manufacturing operation in Bowling Green with a nearly $10 million investment, creating 73 additional full-time quality jobs for the Warren County community. The Canadian-based grill and cookware company will consolidate the majority of its fabrication operations to its facility here in the Commonwealth. The economic momentum we are seeing across the state is a result of companies continuously believing in what Kentucky has to offer, and this is proof. A company that already had an existing facility that decided to bring more of its workforce from around the United States here into Kentucky, knowing we have the best workforce that any state has to offer. I want to congratulate both the company and the Bowling Green community on this great project, and we wish Crown Verity continued success in Kentucky. Since I took office, my administration's been committed to expanding access to quality health care and creating safe communities across Kentucky. Today, we're taking another step forward in advancing legalized medical cannabis in the Commonwealth. Last March, I signed Senate Bill 47 into law. At that time, I was joined here in the Capitol by lawmakers and advocates who also recognize that medical cannabis can help Kentuckians with certain medical conditions. Conditions like cancer, muscular dystrophy, and multiple sclerosis. They can help our military veterans suffering from post-traumatic stress disorder. Since that announcement, great progress has been made, and I'm pleased to report our medical cannabis program is on schedule. Today, my administration filed its first 10 regulations governing this area. They provide the framework for how medical cannabis businesses, including the cultivators, processors, producers, dispensaries, and safety compliance facilities, will operate in the Commonwealth. These new rules will provide guidance for how medical cannabis products will be packaged, labeled, transported, advertised, and tested. These regulations will ensure that Kentucky's medical cannabis program is safe and accessible for all patients, and to make sure that they are secure for our communities. Kentuckians can read each of these regulations for themselves and find out how to participate in the regulatory process by visiting kymedcan.ky.gov. We would not have passed medical cannabis without the input and the action of so many Kentuckians. We invite you to continue to be a part of this process. Read about how you can come in, make your voice heard, submit written comments through the website. Continue to be involved. Additional regulations on how Kentuckians can apply for a medical cannabis business license will be issued in the coming weeks and months, and we're likely to have a few tweaks in this legislative session because some of the dates in the original legislation need to be altered to make the program work correctly in terms of when a business applies for a license, when it's granted, and when they're able to commence business. We've had some early conversations on that, good feedback. Our sense is that everybody wants to make it work, and we hope to get these very small adjustments that are really about procedure and timing done this session. Next, I'm pleased to announce that in October, last October, a couple months ago, the program entered into a partnership with Tyler Technologies and Metric to build Kentucky's medical cannabis electronic monitoring system. Tyler Technologies licensed platform and patent registries, Tyler Technologies licensed platform and patient registries will allow the program to receive and process applications from cannabis businesses and Kentuckians seeking medical cannabis cards. But this is important. This part of the law and this requirement for a medical cannabis card is not in effect yet. Now, I want to take a moment to remind Kentuckians that in 2022, I signed an executive order allowing Kentuckians seeking medical cannabis to have a written certification from a physician. Under the current executive order, in this period of time of the executive order before the law goes into effect, there is no need for a medical marijuana card. We've been made aware of reports that there are businesses not licensed or affiliated with the Commonwealth that are advertising for medical marijuana cards for a fee. Those are not legitimate, most likely fraudulent. You should not try to secure a card through an advertisement that you have seen. Again, right now there is not a card that is required, and if someone is advertising one, most likely it is not legitimate. You can call the Consumer Protection Hotline at 888-432-9257 and select option 3. But getting back to the new program, Metric's track and trace system will provide the ability to track medical cannabis in the Commonwealth from seed to sale and ensure that medical cannabis is secure. But ultimately, this program is about providing health care. It's about providing relief to Kentuckians with severe medical conditions. That's why a third big announcement today, outside of the first set of regulations and the data and tracking systems, I'm pleased to announce that the two independently appointed advisory boards, the Board of Physicians and Advisors and the Team Kentucky Medical Cannabis Work Group, have voted unanimously to recommend that the General Assembly expand the list of qualifying conditions under the law. This is a crucial step. While the legislation referenced several qualifying conditions, it left others out. These new recommendations are about ensuring that Kentuckians, and if we can put up that additional list, with terminal illness, Parkinson's disease, HIV, AIDS, sickle cell anemia, and other conditions have reliable access to medical cannabis. I'll wait for a second to get that slide up, which shows you what some of those are. And it looks like we lost the slides altogether. Here we go. So when you look at this slide, the ones in white are the ones currently approved by the General Assembly for the program. The ones in, can we call that green, are ones that both groups of professionals unanimously voted should be a part of this system. The one in yellow, hepatitis C, one group voted to put it in. The other believes that there is already significant and good medication to address it. So when you look at especially these in green, they are included in most other states' programs. They are very serious conditions that we believe, but more importantly, that these medical groups and advisory groups all unanimously agree should become a part of the program. Currently, to become a part of the program, there's a group out of UK that is supposed to make some of these decisions. We believe that's likely to be altered this session, as there has been some reluctance by that group to participate whatsoever in what was assigned to them by the legislation. Dr. Frederick Stein, chair of the Board of Physicians and Advisors, said in a letter to legislative leadership that it is the board's collective, unanimous medical opinion that medical cannabis may have a positive medical, therapeutic, or palliative impact on Kentuckians suffering from these conditions. This letter is available again at kymedcan.ky.gov. And the other slide just shows you the number of people, 437,000 additional Kentuckians. By the way, those are 437,000 Kentuckians that are suffering from or dealing with the conditions that we just showed up there that are not currently eligible. Very serious conditions. that would then become eligible for this program. I'll now turn this over to the program's executive director, Sam Flynn, who is doing a great job in shepherding what was legislation passed into a functional program that is on schedule and will launch on time. Sam.
Thank you, Governor. I want to thank you for your leadership, and I want to thank the Office of the Governor, Secretary Friedlander, and the Cabinet for Health and Family Services for their support in getting this program off the ground. As a result of that support, today I'm pleased to announce that we've made some key additions to our program executive team. Those new team members include a Director for Licensure and Access, a Director for Enforcement and Compliance, and a Director for Education and Outreach. These individuals have years of extensive experience in the hemp and cannabis industries and other regulated markets, and they will provide us the support needed to complete the implementation of this program on schedule and in its administration in years to come. We've also begun the process of hiring merit staff, and new positions were posted just this morning, and additional postings will be made in the coming weeks and months. For more information and to apply for one of those positions, please visit our website, kymedcan.ky.gov, again, for more information. Lastly, we're pleased to announce the launch of an interactive cannabis zoning business tool that will allow Kentuckians, local businesses, and local governments to understand where cannabis businesses may locate in the Commonwealth. Kentucky law and Senate Bill 47, which was passed just this past year, provides that cannabis businesses may not locate within 1,000 feet of a school or a daycare facility. The tool was developed and embedded on our website to assist proposed cannabis businesses with determining where they might site their businesses. Again, it will assist local governments with determining how to set local zoning ordinances, and ultimately, it will allow Kentuckians to understand where cannabis businesses may end up locating in their communities. Again, I encourage interested individuals to visit our website, kymedcan.ky.gov, and use this informational zoning tool. Thank you, Governor.
Today, I'm excited to announce some great news for two of the high ground communities that we are creating for our Eastern Kentucky families. The U.S. Department of Housing and Urban Development has just approved the environmental assessments completed on Chestnut Ridge and Olive Branch in Knott County. These are the environmental assessments that are required before we can use the $300 million of disaster relief funding from HUD intended to build all across Eastern Kentucky. If we wanted to use those funds, we were also not allowed to use state funds at any of those high ground communities until the assessment was completed. This now means 3 of our high ground communities, Skyview and Perry County being the other, have completed the assessments with the one caveat that there are some that do not have to go through this process, like the cottages at Thompson Branch. The environmental approval gives Team Kentucky the green light to use donated and state funds to build out these 2 properties. We're working with nonprofit partners to begin the construction of homes for flood victims. Right after the floods hit, I promised that Team Kentucky would be there until every life and every structure was rebuilt, and we are keeping that promise. Since then, we've made great progress on 7 high ground communities in the various stages of development that will ultimately house over 500 families. This milestone announcement moves us a step closer. Chestnut Ridge in Knott County will have single-family residences on more than 100 acres with walking trails, outdoor recreation areas, and more, and much of the utilities necessary for that development are already there, meaning it is probably the most shovel-ready area that we have. Olive Branch, which is also in Knott County, will have dozens of homes, senior apartments, and park and recreation space on 75 acres, generously donated by Sean and Tammy Adams. 2024 is going to be an exciting year for rebuilding, especially in Eastern Kentucky, but also in Western Kentucky. I want to thank the cooperation of HUD, and I want to thank all of our nonprofit partners and all the various agencies out there like the Appalachian Regional Commission and others that are helping us to find the sources of funding and the labor that it takes to get this job done. Next, we have an update on healthcare access in the Commonwealth. In November, we announced that enrollment was once again open for Connect, our state-based healthcare exchange. And only 4 days into the new year, I'm happy to report that more Kentuckians are signing up than ever before. As of December 15th, 68,673 Kentuckians had enrolled, and they started receiving coverage on New Year's Day. And that number is still growing. As of January 2nd, 71,414 Kentuckians enrolled for coverage. That's 8,852 more individuals than enrolled last year. 3 years ago, I made a priority to relaunch Connect because I believe healthcare is a basic human right. And today, I'm pleased to see so many Kentuckians taking advantage and receiving the benefits they deserve. If you haven't signed up yet, there's still time. The deadline is January 16th. If you have any questions, we have a team of connectors and insurance agents who are able to help at no cost. They'll guide you through the process of finding quality, affordable healthcare coverage that's best suited for you and your family. If you need assistance or if you're ready to enroll, please go to connect.ky.gov or call 1-855-4CONNECT. That's 1-855-459-6328. So as a takeaway, an incredible amount of enrollments in Connect this year, but there's still time for more. January 16th is the deadline. If you need Connect coverage, make sure you sign up before then. Today, we also have some good news to share when it comes to helping Kentuckians who have been treated unfairly by insurance carriers. When this happens, we have the Department of Insurance's Division of Consumer Protection staff who are ready to help. The work they provide creates positive outcomes for Kentuckians facing a dispute with their health, life, auto, homeowners, and commercial insurers. And they've been doing a great job. From January through November of 2023, the team has received 3,713 complaints for investigation, and they have recovered more than $21.7 million for our Kentucky families. These funds are going back in the pockets of our people. Kentuckians have gotten back premiums, payments for property damage and damage to automobiles, and health coverage claims that were previously denied. And our team doesn't stop there. They monitor these complaints for trends. And when an insurance company is consistently breaking the law, they take action. So we wanted to make sure that we heralded the work of this group, which I'm not sure we've ever done before. That's $21.7 million recovered for Kentuckians. So to our consumer protection group in the Department of Insurance, incredible job. Keep it up. For more information about the Consumer Protection Division or to file a complaint, visit insurance.ky.gov or call 502-564-6034 or toll free 800-595-6053. Next, we have a weather update. I think in our recent mean tweets, I may have been called a weather nerd, and it's going to continue in 2024, hoping there are fewer times we have to provide an update. We're anticipating some snow accumulation late Friday and into Saturday, particularly near I-64 and north of it. Please be extra cautious on roads and sidewalks since they might be slick. And if there's not significant snow on the ground, roads and sidewalks can still be slick. Give snowplows plenty of room on the road and go to snowky.ky.gov for updates on road conditions. This is also a good time for making sure you have the necessary supplies at home and in your vehicles if you drive. Remember, especially in your vehicle, portable chargers and extra batteries, a radio, warm clothes and shoes, a windshield scraper, extra food and water, and a first aid kit and other supplies you may need. Blankets can also be helpful. Remember at home, the generators Camp stoves or charcoal grills should always be used outdoors and 20 feet away from your windows. I can't tell you in the past, thankfully. I don't know that we have an occasion since I've been governor that in some of the coldest times, it's not the cold that's caused the death of many of our people. It's having a generator inside or too close to the house. Make sure you are safe and never use a stove or an oven to heat the inside of your home. Please check on your neighbors and loved ones, especially those who may require additional assistance during this time. We are in close communication with the National Weather Service and Kentucky Emergency Management to provide timely updates and support in managing these weather conditions. As always, I can't stress the importance enough of staying weather alert. Make sure you get updates. Stay safe over this weekend, Team Kentucky. And finally, a State of the Commonwealth recap. Last night, less than a month after being sworn in to a second term, I delivered my annual State of the Commonwealth address. This is a lengthy address because it takes some time to highlight all the good people who've helped us achieve great things. But there are some major takeaways. First, thanks to the strength of our people and our red-hot economy, the state of our Commonwealth is stronger than ever. Second, we are strong and resilient thanks to the many good Samaritans, the helpers, and the heroes that were invited to attend and the address and to be recognized and that represent so many other incredible Kentuckians. This included economic development leaders, teachers, healthcare heroes, and first responders. Third, to capitalize on the work so many Kentuckians are doing to make their communities better, we must seize the opportunity this legislative session provides and to continue to come together to moving forward together. We do this by renewing investments in economic development, renewing investments in communities affected by natural disasters, making game-changing investments in education, continuing to invest in infrastructure, continuing to expand accessible healthcare all over the Commonwealth, and continuing to work to have the best public safety for our people. To me, improving life right here at home is the most important focus that we can have. So much more important than any divisive issue around the country, focusing on the worries of our families when they wake up each and every morning. And these next 4 years are our chance, Kentucky's chance to be the difference, to be both an economic and a moral leader for this country. It's our time to push away the division and to make sure we can govern without the name-calling or the scapegoating, and to do it without anger, hate, or division. That we can not only talk about our collective faith, but live it. And our collective faith is about being good to each other and about caring for every single human being. We have to make sometimes tough policy decisions, but doing it with empathy, ensuring that we are looking out for our fellow Kentuckians ought to be the North Star that guides us every single day and in every vote or decision that we make. Now, in December, I outlined my funding priorities for this current session in my budget address. And last night, I reminded Kentuckians there are several key areas that we need to invest in right now, including funding universal pre-K for all 4-year-olds and doing it in a way that provides support for our child care providers to make the transformation they need to support younger children and after-school programs. And now is the time to pass an 11% pay raise for all public school employees as we're losing too many teachers to Tennessee, to Ohio, and to other states who are stepping up, passing raises, and paying more. Last night, we had a tangible example. It's a man named Matthew Oates, who's an amazing guy. He's been teaching at Muhlenberg County High School and has taught for decades. I met him after the tornadoes in Bremen. He was driving this giant dump truck, and I just got up to say hi and to talk to somebody who was working to get the chaos and the debris out of Bremen. And I said, what company are you from? And he said, no, I'm a public school teacher, Andy. And we sat there and talked. And I just think about how our educators, everybody in our school system, step up, whether it is during the school year, in the school, or outside of it, to help their community. So Matthew's married to Jamie, a third grade teacher who's taught, I think, for about 20 years. 2 educators both having to work 2 jobs to support their family. That's wrong, and we have to do better. An 11% across the board raise would help us to be more competitive with other states. It would ensure that Matthew and Jamie don't have to work 2 jobs. An 11% raise to what is the largest employer in so many of our counties, especially our poorer counties, would do amazing things for those local economies. They wouldn't just help the public school workers. They would help the small businesses, the restaurants, everything throughout that county. It can make a major economic difference, and it's time we took the step. It is the right thing to do. Last night, I also highlighted the need for more funding to support healthcare and mental health care needs of Kentuckians. I shared the story of Norton Healthcare's Karenza Townsend and 988 crisis counselor Haley Johnson, who were in attendance. We recognize Karenza for her role in getting the ball rolling in what is now known as the Norton West Louisville Hospital. She's going to be the Chief Administrative Officer of the newest healthcare facility in the state when it opens. And that's the first hospital in West Louisville in 150 years. We recognized Haley as being one of the first counselors who answers that 988 crisis hotline that helps people when they're considering suicide, when they're in a very difficult place, and when they're reaching out and asking for help. There's somebody who cares and who has the training to provide the very best help on the other side. Remember, that 988 hotline is available 365 days a year. And if you're watching this or you know somebody that needs it, it's okay to not be okay. And we have people waiting right now to help. It is a really tough world. And we all deal with difficult things that our minds and our bodies aren't equipped to handle. So don't let there be a stigma. Reach out and talk to someone. Haley talked about the fact that she follows up with all of her callers to make sure they know that they're not alone. So you are not alone. And we honored those that work in public safety and talked about the $35 million body armor fund that we want past this legislative session to get the best protection to each and every one of our officers. We honored the military service members and law enforcement officers that we lost in 2022 and 2023. And it was really special to have Savannah and Paisley Chaffins with us. Savannah lost her husband. Paisley lost her dad when Kentucky lost Prestonsburg police officer Jacob Chaffins in 2022. I can't imagine how hard that's been on this family, even though I've had the opportunity to be with them a number of times. You look at a young family, much younger than I am, daughter younger than mine. And the fact that his service, protecting us from danger, took him from them means that we have a sacred duty to remember him and his service and to be there for them. We also remembered our other officers who were killed both in that same incident and during that year, as well as Caleb Connolly, Scott County Sheriff's Deputy, who passed away in 2023. We took a moment to honor and pray for all our law enforcement and service members that we have lost and those that are abroad and serving us at home. So, as we look forward to this new year, my message last night was, let's look for new opportunities for progress. The best way we can honor Jacob is to make sure Paisley has every opportunity for happiness and success, that she can not just chase her dreams, she can achieve them right here in the Commonwealth of Kentucky. And that's what we should want for every single Kentucky child. We ought to be willing to push everything else aside to create a better world for our kids. That's why we get into this. We got to make sure that we don't let the politics or the rest cloud us, our judgment, our purpose, or our direction, and trying to do the right thing for as many Kentucky families. And I think last night about the number of special children we had with us. We were joined by the birthday boy, Kyrie, by Caleb, by Maggie, and by Paisley. And this week, I'm naming them our Team Kentucky All-Stars because they are remarkable. I got to spend some time with this is Kyrie. It was Kyrie's birthday. Kyrie's family's home was destroyed by the 2021 tornadoes, and the very next morning, his mom started working in the distribution center. His grandmother had been in a car accident, didn't know she'd ever be able to walk again, and worked in the distribution center and on the toy drive. And after several surgeries, last night she stood up because she can walk again. Thanks to the funds from the Team Western Kentucky Tornado Relief Fund and the work of Pastor Boykin and the Hope Initiative, they have a new home. Who's next on the photos? That's it. That's the only photo. Okay, we also had Paisley, who we talked about before, and how much we appreciate her and Savannah. They are really special and strong people. We saw Caleb and Maggie, who lost their home. Maggie wasn't with us yet, but this family had just saved enough money to make their home their own. He was putting in flooring as the floodwaters came and swept it all away. But thanks to donations from the Team Eastern Kentucky Flood Relief Fund and the Housing Development Alliance, they are in their new home. So as we get to work over these next 4 years, we're going to be thinking about Paisley, Kyrie, Caleb, and Maggie, and the inspiration they provide us each day to wake up and build a better world for them. I'm looking forward to 2024 and the next 4 years because it's our time to turn a great last 4 years of economic activity into decades of progress. So remember, life's short, do good things, and be kind to each other. All right, we'll open it up to questions. We now have 2 journalists that have joined us since we start and 1 on the line. Who wants to start?
Oh, I can.
Okay.
I have 2 questions. One is regarding the medical cannabis and the desire to expand those conditions for access. Are you working with anyone in particular in the General Assembly right now? Are you talking to them about a law that would expand those? You know, are you active in that discussion right now? And my second question is do you have any real numbers around Connect and the Medicaid, not the Medicaid, but the Connect numbers?
Yeah, well, let me search the Connect numbers. Sam, you want to talk first about discussions? Just as a quick recap, we have 2 advisory groups. One's created by the law that includes doctors and other professionals. The second was created with the executive order. Both looked at the legislation passed and both unanimously recommended an expansion of conditions that we want to put back up. Most of these are found in other states' laws. We're talking to members of the General Assembly, the former sponsor, about both this and some technical changes we need. Some of the dates, like dates of application and dates of start of the program, are the same under the law, unintended, but just some small changes we need. Sam, do you want to add anything else? And I'll get you the numbers.
Thank you, Governor. I think you covered most of it. The answer to your question is yes, we've had some productive conversations, particularly with the bill sponsor of Senate Bill 47 from 2023, Senator West. We feel really good about those conversations. As the Governor mentioned, there are some technical changes that we're looking for Senator West and others to take a look at, as well as now expanding the qualifying conditions based on the recommendations made by both the Board of Physicians and Advisors and the Team Kentucky Medical Cannabis Work Group. Thanks.
And the law as it was written has a group at UK that was given the unilateral power to add conditions. Listen, they've told us that they don't want to do it. And if that's the case, we need to make a change in the law. Now, their position might change. It's a legislative session, and they'll have to look at legislators and say that. But they've told us they don't want to do it. So we want to make sure that we're transparent about these are things that they can add while they're here, or the legislature can empower a different group. They created that group of doctors and other medical professionals that have suggested this. I mean, our recommendation to them is give that group the power to expand it. I mean, that's both under the legislation they created. They created how the board is made up, and that would seem like a logical place to go. As of today, Connect signups are 71,414. That is 8,852 more than last year. This is, I believe, our strongest year, at least since the relaunch. Austin.
Thank you, Governor. We've seen a lot of incumbent legislators decide to hang it up this term so far. Why do you think that is? And is there anything that needs to change, whether that's from an environment or pay or work standpoint?
We have had a lot of legislators that have decided that they are going to retire. You should talk to each of them first to get their response. The ones that I know well, they are primarily personal reasons. I believe most would tell you that they like the work, but that the environment has changed a lot over a number of years. It's very different than even when my dad was governor. And I think it's even different within some of the caucuses. And so part of what I've been trying to talk about is to have a future where government works and works effectively for the people. You know, we need to tone down the rhetoric, tone down the attacks. There shouldn't be threats of doing something to your area if you disagree with something that the rest of your party is pushing. I mean, that just shouldn't be the way we act. We ought to have each legislator pushing for the very best for their own district. And so trying to reduce negativity, trying to reduce toxicity. That's one reason I believe that when you have a better mixture of two parties, and I mean that both here and in other states where it can be the other way, can and should create a better environment with a better exchange of ideas. Now, that's probably easy for me to say, being in the party that is in the minority of the General Assembly. All right, we've got Karen Czar on the line.
Governor, thank you. I have two questions as well. The first is, and this may have been difficult to track since people are going out of state, but do you know about how many Kentuckians have benefited from your medical cannabis executive order? And the other is, pay raises for teachers has been your priority since you took office. Yesterday, Speaker Osborne said that that's something that he believes should be taken care of at a local level. What is your response to that plan of action? Thank you.
Well, I think there's a nuance in the speaker's answer. Let me start with the first. We don't have specific numbers on how many people have been helped through the executive order. What we have seen are individuals who had pushed and pushed, families who've been pushed to the brink that know this works, but were worried about being criminals, have found a way, though it's not easy, to gain access to what can provide relief, whether to themselves or to their children. The advocates that we've talked to that have needed this so badly have been able to secure it. And I think it helped get this system passed, which is going to be much better. I want to be the first to admit that while we have to do some work to it, having a medical cannabis system regulated in Kentucky is better than the executive order, and I'm looking forward to us getting it launched. Pay raises for our educators is absolutely critical. And yesterday, what I heard from the speaker is that they were going to look at putting more money into education. Their thought was you include it in the SEEK formula, which ultimately could, if you don't mandate it, which happened in the Patton administration. He put money into SEEK, but mandated a raise, and the legislature passed that. Would ultimately leave it to districts about the raises they would give. Well, guess what? That's what we did the last budget session, and it didn't work. Take Kentucky out of it. Tennessee passed a bill that mandates the raises, right? They've now got the largest teacher raises in their history, and they're talking about being in the top 10. Indiana did what we did in the last session, put more money in overall, and it didn't result in those raises. You know, when I look at a problem, and our teacher salaries, our educator salaries are a problem, I want to make sure any solution fixes it. So if we truly want to fix it, then we have to do both an amount of money for teacher raises that we require to go to teacher raises, but we also have to fully fund other parts of education. Because what happened in the last session is they said, here is new money, and we hope you use it, and we hope you use it for raises, but then they didn't fully fund student transportation. And so you have to take some of that money that's supposed to be for teacher raises and use it for pupil transportation. When you look at our budget, we fully fund that pupil transportation. We fully fund other areas in need, and we provide more than sufficient funds for a mandatory raise. Every superintendent I've talked to As said, as long as you provide the overall funding, and this adds $2.5 billion of additional funding pre-K through 12, then mandatory raises are more than doable. In the end, this is a long session. We have plenty of time, but I think there are a number of legislators who see what was passed the last time, where they said we put a lot of money into education, but the result wasn't what they were looking for. I believe the legislators this time want to ensure that there are pay raises. So we're going to have a lot of conversations about how we make sure that's done. But I don't take any of the comments about pay raises made last night by leadership as negative, as ending the conversation. I think the conversation is still very active in a long session. I believe the talks are still very productive, and I don't doubt that there is a real intent to try to address or partially address this challenge in this session. All right, happy first Team Kentucky update of 2024. I know we'll have a number of more of these. Thank you all very much.